Hey, this is Doug Field, CEO of the Institute for Healthcare Consumerism, and welcome back to Healthcare Consumerism Radio. We've got a very interesting segment coming up from one of the most knowledgeable thought leaders in this space. Joining us on the program today is Chris Ryan, VP of Strategic Advisory Services for ADP. Good morning, Chris.
Good morning, Doug.
Hey, how's things up in Kentucky today?
Sunny and a little cool.
There you go. Yeah, it's a little cool down here in Atlanta. Well, Chris, welcome to the program. I know you and I have known each other for quite a few years. We've seen a lot of changes in this healthcare benefit space and around consumerism. Tell us a little bit about what ADP is doing and tell us a little bit more about ADP Research Institute and what you're doing around research around PPACA.
Well, we're doing a number of things. Of course, ADP has a very large interest in the Affordable Care Act. As many of your listeners know, payroll is the system of record for determining the eligibility of workers for coverage under the Affordable Care Act. And as a result, our clients have a lot of questions about the Affordable Care Act. They have a lot of concerns about how to maintain compliance. And so one of the challenges for us is how do we provide good, objective information to our clients to actually help them get through the Affordable Care Act, be compliant, and then actually take advantage of the provisions of the Affordable Care Act, to provide benefits for their employees. As part of this, we do a lot of strategic research. The ADP Research Institute is an organization with economists and various kinds of experts who actively mine ADP data in order to better understand what's going on with the economy. And your listeners may be familiar with the ADP Employment Report, which we put out monthly, which to some extent mirrors what the Bureau of Labor Statistics is doing. But we're able to pull on literally millions of payroll records as well as benefit eligibility records in order to better understand what's going on in the economy and what's going on specifically in the area of benefits.
Chris, what as you conduct this research, what industries kind of stand up to you that are going to really, face the greatest challenge from the ACA?
Well, you can really, when you boil it down, you can split industries into two categories. Those that have been providing health benefits for years to their employees and are concerned about the impact of the 2018 excise tax, the so-called Cadillac tax, because they really have to think through how they're going to manage their premiums and manage medical inflation so they don't run afoul of that tax in 2018. There's another group of employers who we'll say they're highly leveraged in their use of part-time employees, variable hour employees who don't currently use benefits today. Examples would be business services, accommodation, hospitality, construction. These are all areas where the eligibility pool, the number of employees who are potentially eligible for coverage under the Affordable Care Act, going forward, could increase substantially. And so that second group is the group that probably faces the largest cost challenges short term. It's not so much that health premiums are going up, but that they may have to insure a much larger portion of their workforce than they do today, or they have to take steps to manage the hours of their workforce in order to keep their member roles as they are today. So there are really two different challenges, and it depends whether or not you're focused primarily on an hourly and part-time workforce, or whether you're more focused on trying to maintain premium costs.
Chris, when you look at we hear a lot about certain delays that have happened with the healthcare law. More importantly, the employer mandate delay. What's the reason for an employer, even though they got the delay for a year? What's the reason for them to act sooner than 2015?
Well, there are several reasons. I think one simple fact is that if you want to be compliant in 2015 and you're implementing some form of look-back period to determine eligibility, that look-back period right now it really is starting in October 1st. Mm-hmm. You know, if you imagine a one-year look-back period and you have no more than a 90-day waiting period in order to enroll people, what that means is, as an employer, to be compliant in 2015 and to have accurate records, you want to have your look-back period implemented right now, and you want to be able to use your records right now in order to establish compliance for 2015. So that's a first consideration. I think a second consideration is that, in fact, if you plan to offer health benefits in the long run to your employees, employers are actually going to be competing with public exchanges to get young people to enroll. And so to the extent that employers can actually engage young people, get them into their risk pools, have them participating, that's actually fairly important as well. I think a third point is that, frankly, some of the processes and procedures are sufficiently complicated that it may actually be easier to test them out and harden them in 2014 and make sure that everything is a go, simply because the penalties for noncompliance can be quite substantial. And as an employer, as a benefits professional, you don't want to discover that you're going to be paying, $10 million in penalties, in 2016 for something that you did in 2014.
Hey, Chris, the transitional reinsurance program fees that employers are really going to face, that starts applying in 2014, but doesn't start paying until 2015. Is that correct?
My understanding is that actually is in effect. And I think a key point is that everything associated with the Affordable Care Act, even though penalties were deferred until 2015, every other aspect of the law remains in place.
Right.
And you can really think of the delay in shared responsibility penalties till 2015 as nothing more than a tactical delay. For all practical purposes, the Affordable Care Act is moving ahead. All the strategic implications are the same. All of the fees are essentially the same, and ultimately all of the reporting requirements are going to be the same. So I really emphasize that fact to say that it's only a handful of things that have been delayed till 2015, and they're technically complex, and employers really need to be moving ahead with those things right now.
Good point.
Chris, you just alluded to it a second ago with the cost on being non-compliant, and you being an employer and finding out you're non-compliant. What are some of the things employers, whether it be resources out there, whether it be expertise and making sure they are compliant, what can an employer do to make sure they've got all their bases covered?
Probably one of the most important things is to ensure consistent administrative handling of all employees. One of the things that we see today is that employers often segment their workforce into different categories and may have different systems, procedures, or handling for those groups. So, for example, there are some employers today that have different procedures for tracking their hourly workforce than their full-time workforce. That also they may have different procedures for people who are considered contingent or for interns or whatever. And what we're recommending to people is that whatever you do, you want to do it consistently across your entire workforce. And I think that's a very important administrative principle. What we're seeing is that when the Affordable Care Act doesn't specify whether somebody is part-time or full-time. They don't specify whether they're temporary or seasonal or anything else. All they say is if somebody works an average of 30 hours a week or more than 130 hours a month, then they are eligible for benefits. It essentially redefines eligibility in terms of hours alone, and you need to have a consistent handling around how you determine that calculation for all your employees. Certainly for purposes of record keeping, in the long run for non-discrimination testing, there's just a whole lot of reasons why you want to have a completely consistent approach to employee tracking.
Now, some of the, what are some of the emerging benefit, trends that you see taking place in the market amongst employers to really hold down healthcare costs as they continue to evaluate the healthcare law?
Well, there are a couple of things they're doing. For those that are, especially those that are focused on the excise tax, what we're seeing now is a very strong general movement towards consumer-directed health or healthcare consumerism. And when I say that, I mean it's not just the use of a high-deductible health plan or an HSA. They're also looking very closely at things like population health and wellness and the use of health incentives. The fact that the Affordable Care Act permits up to 30% of premiums to be used in the form of an incentive has really gotten the attention of a lot of employers. And so we're seeing a number of employers actively moving in that direction where they are linking premiums to specific healthy behaviors like, for example, health screening. In addition to that, the Affordable Care Act also permits employers to charge up to a 20% surcharge for tobacco use. Mm-hmm. So again, this is something that employers can do to actively maintain costs or manage costs and encourage people to lose. To stop smoking. Right. In addition to that, we're also seeing the advent of a lot of new consumer-based tools in order to identify low-cost providers, effective providers. I think we're going to be seeing a lot of health plans are going to be introducing new tools that will enable people to do on a mobile phone, literally to be able to shop for a doctor on a mobile phone. And I think that, again, will also be something that will be very, very effective for managing cost.
Chris, what do you see as the impact? I know we're really early in the game, but what do you see as the impact from defined contribution and private exchanges?
Well, I think there are two things I would say. Generally speaking, I think it's fair to say that a defined contribution approach is something that will likely emerge with or without a private exchange. It's certainly something that any employer can implement. I think the challenge with private exchanges right now is that there are a lot of different flavors in the marketplace today. It's a very new concept. We see private exchanges being implemented that are designed around a fully insured model. Mm-hmm. Others that are being designed around a self-insured model. With different types of designs, plans for risk sharing, and I think that it's a little bit early or premature to say how successful or which approach among the different exchange types is going to be the most successful. Generally, when I'm talking to clients, my advice is that unless you have a compelling reason to be a first mover into a private exchange, we're really in a wait-and-see mode right now. I think it's going to be interesting to see how the market sorts out the different kinds of designs. One observation I would make is that larger employers and self-funded employers have a substantial cost advantage over employers who are using a fully insured model, and I think that also applies when you're looking at opportunities with a private exchange versus a large self-funded plan where you essentially are locking in with a strategic relationship with a TPA. So the jury's out. I think it's something we're going to monitor very closely, but at this point, there are just too many different alternatives on the marketplace, each with their own regulatory concerns, to say that one design is going to be more successful than another.
Hey, Chris, thank you so much for joining us on the program today, and would love to have you back another time. We're up against a hard break. Thank you so much. Have a great weekend, and to the rest of our audience, stay tuned for the next segment of Healthcare Consumerism Radio.